My name is Bunja Rungruang, and I am a gynecologic oncologist at the Georgia Cancer Center and Augusta University. This project was a collaborative effort between our fellows, Jennifer Vaz, Bogna Brzezinska, Jessa Suhner, and our psycho-oncologist, Dr. Lauren Bigham. The goal of this project was to try to provide psycho-oncology care for as many of our gynecologic oncology patients as possible. There's a health disparity and an inequity amongst some of our patients where they don't have coverage, or they're underinsured, or they don't have insurance coverage that allows them to get mental health services, which can have a significant impact on them during the course of their cancer care.
Oftentimes our patients wonder maybe why they're being referred to a psycho-oncologist or to a health psychologist. But we also know that cancer and that experience and that diagnosis can really impact how a person thinks, feels, behaves. And we know that those things in the long run really have an impact on our outcomes. So depending on how they're thinking, it could impact how often they take their medicine, or even coming to appointments. To really get our patients the care that they deserve is to really offer them all the services that they need. And that would include looking at their emotional health in that process where we're taking care of the entire individual, to be truly comprehensive and holistic in our care.
Our collaborative effort with psycho-oncology here started actually out of a quality improvement project where we were seeking to assess patients' other needs, such as nutrition or mental health services. And we found that over 15% of our patients were screening positive for depression or anxiety. And this kind of demonstrated the real need for mental health support in our patients.
Oftentimes we are able to help our patients physically with chemotherapy and surgery, but sometimes we don't have the resources to help them with their mental health, so we're very grateful for this grant. We're hoping to help up to 70 patients by offering individual therapy and group therapy.
We're hoping over the next year to compile data from all the patients that are participating and see if we can apply for future funding, so that hopefully this resource can become a more permanent factor in our patients' care moving forward.
Unite in the Fight is a very important cause which made this project possible by grant funding. I encourage everyone to get involved and to consider donating to the cause, because it allows us to do important things in our local community at the Georgia Cancer Center to impact patients here in Augusta, as well as in the surrounding areas that refer patients into Augusta. Without this grant, there are so many patients that would not be able to afford this care or have coverage for this care, which will make such an important impact upon their cancer.